Dr. Oscar is joining me in the studio. आणि दोतोर म्हाका मुद्दम हे विचारपाक जाय. You took both the doses. After that, you got infected with COVID. You recently recovered. When आता जेन्ना दोतोर सांगतात हो data, how do you look at it? Because you got both the doses, you got infected, you recovered from it. How do you look at this entire thing now? Not only from a doctor's perspective now, but from a person who I think you relatively felt very safer after those 2 doses. Still got COVID. What's your experience?
आजो प्रश्नूच ना की सगळ्या गोंयकारांनी बुदवंत जे आसात पळय ते आनी म्हाज्या प्रमाणे सगळे गोंयकार बुदवंत चड बुदवंत वॅक्सिनेशन म्हणल्यार घेवपाकूच जाय. दॅट इज जस्ट इट्स अ नो ब्रेनर. इज्रायल घे तूं, युनायटेड किंगडम घे तूं, बाकीचे युरोपियन कंट्रीज घे तूं, द होल ऑफ युनायटेड स्टेट्स ऑफ अमेरिका. डॉनल्ड ट्रंपाक आमी फकाणां करतालीं पूण ॲटलिस्ट डॉनल्ड ट्रंपान खरेंच म्हणल्यार गॉट द वॅक्सिन्स आउट एट वॉप स्पीड. And the vaccines today are available. The US managed to procure the vaccine. And today you can walk in any store. Even if you are traveling to the US as a tourist, you can just go up to any store or you can go up to any center. Without any questions, the vaccine is given to you. So vaccination is the way for us to fight the pandemic. I don't think there can be any debate on this, or there can be any kind of worries about deaths, etc.
So कांय जाण जे घराडेन बसून चिंततात की वॅक्सीन
ताजो प्रश्नूच ना की वॅक्सीन घेवपाकूच जाय म्हणून. कित्याक कोण म्हणटा की वॅक्सीन घेवन असले सायड इफेक्ट जाता. तशें क्रोसीन गुळी घेतल्यारूय सायड इफेक्ट जाता. पूण तुमकां जोर येता पळय तेन्ना क्रोसीन गुळी घेतात न्ही तुमी. कॉप मारल्यारूय तुमकां सायड इफेक्ट जावंक शकता, पूण कॉप घेतात न्ही तुमी. सो तशें वॅक्सीन घेवपाकूच जाय. फक्त तुमकां म्हणून सांबाळपाक न्ही, पूण बाकीचे तुमचे फॅमिलीक सांबाळपाक, तुमच्या इश्टांक सांबाळपाक आनी समाजाक सांबाळपाक. सो दिस इज very important. And this is where, of course, our government, locally and nationally, here is where we took the eye off the ball. We did not vaccinate when we thought that the pandemic was behind us. And म्हणून हो crisis आयलो पळय तो. Maybe we are making amends now, and let's hope those amends are made in the right direction. But I think we need to go one step further. I would like to describe this COVID disease, in my opinion, something like cancer. So you have a stage 1 cancer, which is very easy to treat normally as cancer, and then you have cancer which has spread completely, which is very difficult to treat. Now in the first week, समज फक्त तुमका sense of smell आणि sense of taste गेलो समज जाल्यार, किंवा तुमका फक्त मातशें आंग दुखपा लागलें आणि जोर ना जाल्यार, all right, that is it. You've had a mild attack. This is asymptomatic. You leave it. पूण समज पयल्या आठवड्यान तुमकां जोर उरलो जाल्यार 100, 101 जोर पयल्या आठवड्यान, आनी तुमकां सामकें नजो जाता, सारकें जाम पडटा, तूं न्हिदूंक सोदता, at this point of time you need to act. And in my opinion, the drug that helps, I know this from personal experience, is remdesivir. ह्या वेळार remdesivir दिवपा जाय पयल्या आठवड्यान, because this is the time. Remdesivir is an antiviral drug. So पयल्या आठवड्यान व्हायरस जो आसा पळय तो मल्टिप्लाय जाता, आणि ताका आडोवपाक रेमडेसिवीर इन द फर्स्ट वीक जेन्ना तुका खूब जोर येता, जाम जाता पळय तेन्ना, नॉट वेन युअर ऑक्सिजन लेवल्स हॅव ड्रॉप. Because after the 10th day, when your oxygen levels drop, it goes to the lungs and you are completely with your blood pressure down, and सामको मागीर खरस मारून तूं धांवत आसता सगळ्या हॉस्पिटलान, ऑक्सिजनाची गरज पडटा पळय तेन्ना, that time you are already in cytokine storm. And त्या वेळार रेमडेसिवीर उदक किंवा उर्राक, there is no kick for remdesivir at that point of time. आणि त्या वेळार once you are in cytokine storm, तूं खंय वच, जगान खंय वच, तुका स्टिरॉइड्स दितले, टॉसिलिझुमॅब दितले, ऑल इम्युनोसप्रेसंट्स दितले, ते दिवन मागीर तुका म्युकॉरमायकोसिस जातले, बॅक्टेरियल इन्फेक्शन जातले. So at that stage it is anybody's game. That is like cancer which has already spread. That is cancer which you may recover from it, you may not recover from it. So our whole focus, in my opinion, has to be in that first week when you're running very high fever. And I'm sure many families which have lost dear ones, if you reflect back, you'll go back and you'll see that in that first week when you thought beto जोर येतलो, कमी जातलो, काडामोड जातली आणि मागीर 8व्या दिसाक 9व्या दिसाक धाम पेशंट क्रॅश जाता आणि हॉस्पिटलान पावता. त्या वेळार रेमडेसिवीर काम करना. सो इन माय ओपिनियन, I will get a lot of flack from my medical community for saying this, because people just hate the drug remdesivir, and I don't know why Gilead and Cipla and all the drugs which are marketing remdesivir don't do a study on this. But remdesivir in the first week when you are having high fever and you're feeling completely lousy, definitely works. Also what works now is the Trump cocktail. They are available zala, marag, पूण जो कॉकटेल आमी यूज करता पळय तो बाकीच्या हॉस्पिटलांत सुरू जाला, आमच्या हॉस्पिटलांत सुरू जाला, that definitely makes a huge difference. And now things are coming up by which you are trying to get intranasal antibody cocktails, you're trying to get drugs which can be used as a that's in the form of tablets to be used as a cocktail.
Because you brought up the issue of remdesivir. Now that we are talking about remdesivir, we have seen about plasma. Now all medical fraternity said, all of you doctors said, even in Goa, that plasma works.
Yes.
It is withdrawn.
Yes.
Even you said remdesivir works.
No.
It's withdrawn.
No.
Today you have withdrawn ivermectin and doxycycline also.
Correct.
So how should people, common man, believe whatever that anybody is saying right now?
Correct. I agree with you fully, and this is the reason why everybody believes Baba Ramdev and doesn't believe us. But medicine is something that is always trial and error, and something that comes in the form of a pandemic. You don't have the time to do your randomized, double-blind, controlled trials that we do for all other diseases that slowly progress and slowly evolve. So we are learning on the fly. We are learning as we are treating patients, and from there we are trying to get things up. You know, it's phenomenal that allopathic medicine has been able to devise the genomic sequence of the virus in 1 year. You've been able to get a vaccine, not just 1, 3, 4, 5, 10 vaccines in 1 year all over the world. I mean, it's a phenomenal contribution of allopathic medicine. But yes, treatment, we are still evolving. We are still learning. Plasma कितें जाता? Plasma is antibodies. And in my opinion, again, plasma is still useful if used in the first week. So you've got to tackle the virus in the first week. So the antibody cocktail, plasma or remdesivir in the first week if the patient is sick. Not if the patient just has loss of taste, loss of smell and is otherwise fine. But if the patient is sick with high fever, remdesivir, plasma or the antibody cocktail still would be a treatment option in the first week or the first 10 days. After that, once you're in cytokine storm, then it's anybody's game. And yes, once you're in cytokine storm, which is the time when most patients end up in hospitals, that's the time remdesivir will not work, plasma will not work, and only steroids and the immunosuppressive agents will work. And that's why remdesivir and plasma get a bad name, because remdesivir and plasma are being used during the cytokine storm and they're not being used in the initial phase of the illness.
Okay, then my next question is about, now you're talking about remdesivir, plasma, which are kind of emergency. You give those to save person's life. Now that goes either way. But what about doxy and ivermectin?
No, doxy.
So now all of you have been prescribing it.
Correct.
Today Health Ministry
Correct.
is saying that
Correct.
no use of doxy, no use of ivermectin.
Correct. These are all.
And you are treating patients. So what's your experience?
See, Pramod, in that sense, the news bulletins that you give out, what is gospel truth for you today turns out to be not gospel truth one month later. No? You don't shut down the news bureau only because of that. So there were lab studies that showed that hydroxychloroquine or ivermectin or doxycycline or azithromycin would work in some way against the virus. But now, once you see it on the field, that those drugs that were used randomly and in a vast population of people, they clearly were not working. They were clearly not letting people who were taking these drugs, not preventing them from going into the cytokine storm stage. You're finding them going in the cytokine storm stage. So yes, in medicine we revise. We say that we are wrong. Unlike Baba Ramdev, we say where we are wrong and we move back.
So
we step back.
Two questions when it comes to ivermectin and doxycycline. Are you saying, number one, that if somebody is already infected with COVID, there is no point in giving ivermectin and doxy?
That is the recommendation.
Is what government of Goa was trying to do is use it as a prophylaxis treatment. So you are ruling out ivermectin and doxy for both.
As a prophylaxis, it was God alone knows from where this idea, from which hat it popped up, but something had to be done. So probably that's the reason why ivermectin is a prophylaxis. That was ridiculous, to say the least. But even as treatment now, and doxycycline as treatment, yes, this is hugely being contested across medical hospitals across the country. And I think that has been withdrawn now, and we'll have to accept that is now going to be the basis, that you just take symptomatic treatment if you are mild. But I again reiterate, if you have high fever and tu jam jata, tu sarke puro jata, janto manis tujo sarko nakakon jeona samko khatiruch podon asa poito, this is the time that you need to get them to the doctor.
Week one.
Week one, you need to get them into the hospital. You need to get them on remdesivir. You need to get them on fluids. You don't need to get them on steroids. You can't get on steroids in the first week. You're going to make matters worse. Steroids only in the second week. So in the first week, jenna जोर आसा पळय तेन्ना आनी मनीस जाम जाता पळय तेन्ना हॉस्पिटलान वचात. We were wrong about saying that it's only when your oxygen levels drop. That is already a little bit too late, and it's more difficult to save patients once they are on HFNOs and ventilators.
One more question, if that is the case, then how effective is home isolation?
Effective home isolation is only if it is monitored properly. And if असली जर लोकांक अशें समजून येता की हो बेटोच जोर ना कांयच ना सदांचे भशेन जोर आमच्या जाणट्यांकूय असोच जोर येतालो आनी ते बरे जाताले 2-3 दीस पळय तूं पूण 5वो दीस 6वो दीस मनशाक कांयच करपा जायना. ऑक्सिजन लेवल्स आर नॉर्मल, रिमेंबर ऑक्सिजन इज 99%, पूण मनशाक कांयच करपा जायना, सारको जाम पडला, जेवना, इतलो फेटीग आनी जोर येता पळय तेन्ना ह्या वेळार हॉस्पिटलान व्हरपाचो आनी ह्या वेळार एडमीट करपाचो, ह्या वेळार रेमडेसिवीर दिवपाचें, प्लाझ्मा दिवपाचें किंवा अँटीबॉडी कॉकटेल दिवपाचें. दिस इज व्हेरी व्हेरी
Before I go for
in my opinion.
one clarification to Dr. Prashant Suryavanshi, I want to ask you one final question. आता जर तुम्ही numbers पळयले जाल्यार तुमकां कितें दिसता, are our numbers coming down because the restrictional movement, curfew, our numbers are down right now and we cannot be complacent?
माझ्या प्रमाणे प्रमोद दोन्ही गोष्टी. The wave, it's always been 2 months. The last time also it was August, September that we were like ravaged, and then by October it started dying down and November it went off. So by July you will find that we'll be back in action. माझ्या प्रमाणे I have little doubts about the fact that फक्त of course the Kumbh Mela was blamed, the Bengal elections were blamed, whatever, all the political rallies were blamed, which were partially to be blamed. पण माझ्या प्रमाणे it is about this virus mutating. There is the mutation in the virus. कित्याक लोक हांगा गोंयांत डिसेंबरान आशिल्ले, जानेवारीन आशिल्ले, मजा करताले, कजिनोन आशिल्ले, फॉल्गां मारताले, पूण तेन्ना व्हायरल लोड नाशिल्लो. सो माझी राय कितें की the virus mutates, and when the virus mutates then you've got to be very careful. It is like a war. So समज तूं एक जंग, तूं एक घेर्रान आसा पळय आनी समज तुजो दुस्मान त्या सायडीक न्हिदला, समज तो न्हिदला जाल्यार मागीर तुमी भायर सरात आनी मातशी थोडीशी मजा करात, उलयात आनी हें करात तें करात. पूण समज तो दुस्मान उठला जाल्यार, हो व्हायरस उठलो जाल्यार, म्युटेट जाल्यार आनी बॉम्ब ड्रॉप करीत जाल्यार तुज्यार, मागीर तुज्यान फॉल्गां मारपा जायना, कजिनोन वचपा जायना, रेस्टॉरंटान वचपा जायना. You have to go to your bunkers, go and hide as quickly as possible. You got to go and hide. So the point is, there is a good chance that this wave might come on again. You might have a third wave. And I again don't believe that only the pediatrics are going to get affected. It looks like as if the children have been put in some island in Mauritius and they're going to be brought back for the third wave. And they're there with their parents. They're getting infected even now. You ask the pediatricians. Large number of kids are getting infected even now, but they're doing pretty well. So don't focus on the kids. It's about the virus mutating again in the third wave, and hopefully that mutation will be milder than what it was in this second wave. That is the hope.
Yeah.
But if it comes on, परत तुका दिसलें जाल्यार नागपुरान, अहमदनगरान, अरे सडनली 5,000, 25,000 केसीस आयली जाल्यार येता म्हणून बॉम्ब्स परत पडटात. आता रिस्ट्रिक्शन आता तुका रिस्ट्रिक्शन्स काडली की मारात तुम्ही थोडी फॉल्गां, ऑफकोर्स मारात थोडी फॉल्गां, पूण कळ्ळें की बॉम्ब पडपाचे आसा पळय ते ताबडतोब तुम्ही बंकरान वचपा जाय, लिपूंक जाय, जाता पळय तितके. That is the key, the swiftness of being able to understand that this virus is mutating and it's coming to you as the third wave. And this time you've got to be prepared by going into curfew. So you have to adapt to how the virus changes.
Very important points, Dr. Oscar.